having a tough time learning scalp, then don't worry, let me teach you about it. But before that, I'm Hariharan, a third year med student, and I'm going to teach you anatomy in my channel Naralu. So if you want to learn anatomy with me, make sure to hit that like button and subscribe to my channel Naralu. Okay guys, let's get into today's topic, scalp. It refers to the soft tissues covering the vault of the skull. The extent of scalp: anteriorly it extends till the supraorbital margin. Posteriorly it extends up to superior nuchal lines. Laterally it extends till the superior temporal lines on the both sides. Now let's get to the diagram and visualize it. This is the diagram of a scalp. See this shaded region here? This is the scalp. Anteriorly it extends till the eyebrows. It's also called as a supraorbital margin. Posteriorly it extends till the superior nuchal line, and laterally it extends till the superior temporal line. After seeing the diagram, you have understood the extensions of the scalp. Now let's go into the layers of scalp. The scalp mainly consists of 5 layers, that is the skin, the connective tissue, the aponeurotic layer, the loose areolar tissue, and pericranium. It could be remembered by the mnemonic SCALP, which is the same as the letters of the scalp. Let's see each layer in detail. Number 1. The skin. The skin in the scalp is thick and hairy. It has sweat glands and sebaceous gland. That is why it is the commonest site of getting sebaceous cysts. From this diagram you see this exactly how the layers of scalp are arranged. The outermost layer is the skin. Next, the connective tissue layer. Below it is the aponeurotic layer. Together these 3 layers are called the surgical layer of scalp. And below the aponeurotic layer is a loose areolar tissue layer. Below it is the pericranium, and thus the 5 layers of scalp. Now let's go into the second layer of scalp, that is superficial fascia layer, also called as connective tissue layer. It is made up of dense fibrous connective tissue that firmly binds to the occipitofrontalis muscle and the underlying aponeurosis, which forms the third layer of the scalp. The fibrous septa divides the second layer into number of small pockets containing lobules of fat. This is the layer of scalp which contains the blood vessels and nerves of the scalp, and damage to these blood vessels can cause profuse bleeding. Now let's go to the third layer of scalp, that is the aponeurosis layer. It is also called epicranial aponeurosis or Galea aponeurotica. It is formed by the occipitofrontalis muscle and its aponeurosis. The aponeurosis part is the majority part. The occipitofrontalis muscles contains 4 bellies, that are 2 frontal bellies and 2 occipital bellies. This diagram clearly shows the occipitofrontalis muscle and its aponeurosis. You see in the front of the skull bone, the frontal bellies are present, and in the back of the skull bone, the occipital bellies are present. The frontal bellies are supplied by the temporal branch of facial nerve, and then the occipital bellies are supplied by the posterior auricular branch of facial nerve. Now let's go to the fourth layer of the scalp, that is a loose areolar tissue layer. As the name suggests, it consists of the loose areolar tissue. It serves as a natural plane of cleavage during a craniotomy procedure. This layer is transversed by the emissary veins, the veins which connect the second layer with the intracranial dural venous sinuses. Now finally, let's go to the fifth layer of the scalp, also called as the pericranium. It is formed by the periosteum of bones of vault of skull. It is loosely attached to the surface of the bone, but it is firmly adherent to the sutures. The main clinical importance of this layer is cephalohematoma, which is edema which occurs due to subperiosteal collection of the blood. In this condition, blood collects below the layer of pericranium. As this pericranium is loosely attached to the surface of the bone, it will get completely filled by blood, but it is firmly attached to the suture. Because of this reason, the blood cannot travel outside of the suture. That is why it looks like the skull bone. This particular edema will resemble the skull bone. Now let's see the arterial supply of the scalp. Scalp is mainly supplied by 5 arteries. 3 of them enter in the front of the auricle. Those 3 are: number 1, supratrochlear artery, which is a branch of the ophthalmic artery, which in turn is a branch of the internal carotid artery. The second one is supraorbital artery, which is also a branch of ophthalmic artery, which is also in turn a branch of internal carotid artery. The third one is superficial temporal artery, which is a branch of external carotid artery. The other two arteries enter from behind the auricle. Those arteries are number 1, posterior auricular artery, and number 2, occipital artery. Both of them are branch of external carotid artery. You can remember all of these arteries using a simple mnemonic, that is 3S2PO. 3. 3 means in front of the auricle there are 3 arteries, and S signifies supratrochlear artery, supraorbital artery, superficial temporal artery. 2 signifies 2 behind the auricle, which in turn has P and O. P is posterior auricular artery, O is occipital artery. So yeah, simply you can understand and remember it. This diagram shows the arterial supply of the scalp. These 3 arteries are located in front of the auricle. Those arteries are the supratrochlear artery, the supraorbital artery, the superficial temporal artery, and there are 2 arteries located behind the auricle. Those are posterior auricular artery and the occipital artery. All of these arteries are located in the second layer of the scalp. That is the reason if the second layer of the scalp gets into any trauma, then it will lead to profuse bleeding. There is another clinical importance for the blood supply of the scalp. You see here there is the temporal flap. The temporal flap is a flap taken during a craniotomy procedure where incision is put at the center and it is drawn till the periphery, where they can remove a flap this way. If you do the procedure like this, then the blood supply to the scalp region is preserved and the bleeding is minimized. Okay guys, that's the main clinical importance for the arterial supply of the scalp. Now let's go into the venous supply of the scalp. Venous drainage of the scalp. The scalp region is mainly drained by 5 veins. Those are supratrochlear vein and supraorbital vein. Both of them join together to form the angular vein, which continues downwards as the facial vein. Next is superficial temporal vein. It descends in front of the tragus part of the ear to enter the parotid gland, where it joins with the maxillary vein to form the retromandibular vein. This retromandibular vein has 2 divisions, that is the anterior division and the posterior division. The anterior division joins with the facial vein formed by these 2 veins, and they together form the common facial vein, which drains into the internal jugular vein. The posterior division of the retromandibular vein joins with another vein called as the posterior auricular vein, which once again drains the scalp. These both of them unite together and drain into the external jugular vein. Finally, the scalp is also drained by the occipital vein, which terminates in suboccipital venous plexus. Now let's talk about an interesting group of veins called as the emissary veins. These are the veins which connect extracranial veins with intracranial veins. You see, all those veins which we studied earlier, which drain the scalp, are connected to the intracranial veins through these emissary veins. Examples of emissary veins are parietal emissary vein and mastoid emissary vein. Clinical importance is these veins act as a route of transmission of infection from extracranial to intracranial spaces. Now let's go into the lymphatic drainage of the scalp. The anterior part of the scalp, except for the lower half of the forehead, is drained by the preauricular, also known as the superficial parotid lymph nodes. The posterior part of scalp is drained into the posterior auricular lymph nodes, also called as the mastoid, and the occipital lymph nodes. Now let's get into the nervous supply of the scalp. The scalp is supplied by 10 nerves. In front of the auricle, 5 nerves enter. 4 of them are sensory and 1 is motor. Supraorbital nerve, supratrochlear nerve, zygomaticotemporal nerve and auriculotemporal nerve are the sensory nerves present in front of the auricle. Temporal branch of facial nerve acts as the motor nerve, which is located in front of the auricle. Behind the auricle also 5 nerves enter. 4 of them are sensory and 1 is motor once again. Greater auricular nerve, lesser occipital nerve, greater occipital nerve, third occipital nerve are the sensory nerves that enter behind the auricle. Posterior auricular nerve is the motor nerve that enters behind the auricle. You can visualize the sensory nervous supply of the scalp through this diagram. You see, in front of the auricle, there is supratrochlear nerve, there is supraorbital nerve, there is zygomaticotemporal nerve, and there is auricular temporal nerve. Behind the auricle, there is greater auricular nerve, the lesser occipital nerve, the greater occipital nerve, and the third occipital nerve. Now let's get into the clinical importance of the scalp. Number 1. Surgical layers of the scalp, also known as scalp proper. It is the first three layers of the scalp which consists of the skin, connective tissue layer and the aponeurotic layer. It is in this plane that surgeons mobilize the scalp flaps. The second importance is black eye. The blood and the fluid collecting in the layer of loose areolar tissue following a trauma on the head can cause generalized swelling of the scalp and the eyelids, as shown in the picture here. The third main clinical importance of scalp is safety valve hematoma. In cranial vault fractures of children, sometimes there is tearing of dura mater and the pericranium. In such condition, blood first collects in the subaponeurotic space of the scalp. Hence, it will delay cerebral compression. That is why it acts as a safety valve and hence its name, safety valve hematoma. The fourth main clinical importance is caput succedaneum. It is caused due to venous interference in newborn children during the birth. Observed as subcutaneous edema over presenting part of the baby's head at delivery. Most common form of birth trauma of the scalp. Guys, that's it for today's video. If you want to study more interesting topics of anatomy with me, then make sure to hit that like button and subscribe to my channel Naralu. And if you want my handwritten notes, then join the Telegram group link which I posted in the description below.